Welcome back to the CTV News. There has been a defense of Health Minister Alvina Reynolds by a high-level employee within the ministry. The minister in recent times has come in for stiff criticism from the opposition benches and the public for the state of the healthcare sector. But Permanent Secretary in the ministry, Corinthia Thomas, says Minister Reynolds is not only dedicated to the task, but is truly concerned about the quality of service all St. Lucians receive. The Permanent Secretary was at the time addressing a staff award ceremony hosted by Victoria Hospital.
Among her many priorities, staff welfare and the health of St. Lucians is paramount. Whenever we encounter a challenge, the first question she puts to me is, P.S., what about the staff? How are they doing? Then she says, we must go to them. Secondly, there isn't a discussion or conversation, formal or informal, I have had with her where she doesn't reaffirm the actions needed to address the healthcare of children, women, men, the vulnerable, the mental health and overall wellness of St. Lucians. And so tonight, it is important that we salute our minister, the leader of the staff of the Ministry of Health.
Meantime, the Permanent Secretary told the gathering that the service delivery experience affects public confidence and trust.
Many strides have been made to improve service delivery, and the implications for the hospital to contribute to improved care is real, even more now than ever before. At the hospital, you are faced with challenges as well as opportunities. Opportunities which raises expectations for citizen-centered service with the ever-increasing demands for health services. There is a need to build up on current achievements and create more immediate change where it is necessary. Perhaps most important, service delivery must be citizen-centered because every act of service is a moment of truth in which citizens form an impression, positive or negative, about the effectiveness of the public institution.
And Minister Dr. Robert Lewis, who addressed the ceremony, lauded the staff for their dedicated service, highlighting his own encounters at Victoria Hospital.
I have been to Victoria Hospital in the last 9 years, because I've been an MP for the last, 8.5. And I have never had a problem at VH before that. But in particular, the last 8.5 years, every time I go to VH, I really get superior service. In that, I just think that the nursing staff and the doctors were there, they always look out for the patients. And I remember very well when I was a young child, at about 7, I did have an injury. I lost part of my finger. And I can never forget Nurse Senkwa. You know, when she held that hand, I didn't feel any pain anymore. It's something, every time I see her, it reminds me the importance of healthcare workers. And I have a lot of time for nurses, because I believe that nurses give a lot of their time, even when things are not going well for them personally. So I want to congratulate all the awardees this evening. I have been a patient at Victoria Hospital as a child, and therefore I know what it means to have the services of a nurse and people who care about you.
And the hospital's executive director, noting the challenges at the facility, spoke of the importance of worker appreciation and the resulting impact on job satisfaction.
The quality health service which the public expects is the experience which can be referred to as from the gate to the ward. The majority of our staff members want nothing more than to improve that patient experience, and this can only be achieved when staff is motivated and encouraged. While an award ceremony was not identified as one of the 5 languages of appreciation by Dr. Gary Chapman in his book, The 5 Languages of Appreciation in the Workplace, it nonetheless serves as an attempt to recognize the exemplary service of the staff. It is a demonstration of our appreciation of work done, and one of the ways we can say to you that we value what you do.
Jeanette Hughes, the Executive Director of Victoria Hospital there.